Hello, my name is Stephanie Swanson. I'm a doctor of acupuncture and oriental medicine. I focus on women's health, aging adults, and musculoskeletal conditions. Today I'm going to talk about how brain health is understood and treated from within the Chinese medical paradigm. And so I'm first going to give an overview of some of the key characteristics and theories of Chinese medicine in order to provide some context. Chinese medicine is based on patterns of nature, both on the earth and in the sky. The way that stars, moon, and sun move, as well as the way ecosystems, night and day, seasons, and weather all interact, can be seen very similarly in the human body. The goal of Chinese medicine is for the pattern within a human body to be matching the patterns of nature. And when this occurs, we see good health occur. So that's the goal of Chinese medicine. One way this is often described is that our bodies are a microcosm within the macrocosm of nature. Chinese medicine views every part of the body as dependent on the health of the body as a whole. Understanding the intricacies of the interdependence of all the physical and energetic components of the body, as well as interdependence of humans with their environment, is of great importance in Chinese medicine. This holistic quality is exemplified by the principle that each person possesses a single underlying pattern of imbalance. It is this pattern of imbalance that is the main determinant of which herbs and acupuncture points we use in treatments. The underlying pattern of imbalance is often referred to as the root of a disease. The branch refers to the manifestations or the symptoms that result from the root. So this root and branch concept and this focus on the underlying pattern both help to explain why it is so common in Chinese medicine for there to be numerous different potential treatments for the same disease, depending on the individual presentation. For example, 10 patients with depression might receive 10 very different Chinese medical diagnoses and treatments. And then Chinese medicine has a strength of foresight and prevention. We can identify patterns of imbalance when they are still rather minor and perhaps not showing up yet as symptoms or disease that are noticeable to the individual. We do this through recognizing sometimes subtle signs like the qualities in the pulse and the tongue, and combined with symptoms, which may or may not be subtle. And then we can improve the patterns of imbalance before they get to such a degree that they start causing disease. The old Chinese medicine saying, "Do not wait to dig a well until you are already thirsty," exemplifies this point. Chinese medicine addresses most aspects of brain health, including most conditions which are considered neurological, cognitive, or psychological. As you can see from this list, it is quite a wide variety. This list is based on both classical and modern Chinese medical texts, as well as modern peer-reviewed research. So the way that Chinese medicine approaches brain health is very similar to the general way it approaches most aspects of our health, which is all about pattern differentiation. So there's a single pattern in each individual, and that pattern is present throughout the entire body. That pattern contributes to every symptom that person is experiencing. And when the pattern improves, the symptoms and diseases improve. And these various patterns of imbalance I keep referring to are usually some version of excess and or deficiency. So excess is also sometimes referred to as stagnations. Examples include dampness, phlegm, wind, heat, cold, qi stagnation, or blood stasis. And then there are deficiencies, which is generally deficiencies of some type of energy or substance in the body. For example, spleen qi deficiency, kidney yang deficiency, or blood deficiency. Which of these patterns is present can be determined based on the whole picture that the patient is presenting. And this whole picture is determined based on a thorough questioning where even symptoms that seem totally unrelated are important, visual inspection of different parts of the body, often the tongue, and also the complexion, eyes, and fingernails. And then there's palpation, in other words, touching or feeling the different parts of the body. So this very commonly includes the pulse at the wrist, but also other areas such as the abdomen and other tissues to find variations in quality of the muscles, channels, or skin. And so this type of treatment based on pattern differentiation is different from treating symptomatically. Treating symptomatically, for example, would be if someone comes in with insomnia and you just prescribe them the great insomnia formula, or if someone comes in with anxiety and you just do the great anti-anxiety acupuncture points without addressing the root. We sometimes go in the direction of symptomatic treatment depending on the intensity or the severity of the symptom at the time. But when possible, the emphasis is on treating the root. A wonderful bonus to treating a disease by treating the root is that many other aspects of the body will start to function better. Everything from cellular level to whole body systems, organs, and musculoskeletal balance even. I do see this quite a bit in my practice with brain-related symptoms or conditions improving while other conditions are being treated. Such as, for example, someone coming in with back pain and then starting to notice that their memory and clarity is greatly improved. Or someone that I've been treating for infertility will start to notice that their anxiety is greatly improved. So treatment can look a lot of different ways, but the most common scenario is that the patient goes to an appointment, whether it's in person or virtual. There's discussion around any changes and how the patient is doing in body and mind. The practitioner performs the diagnostic assessments, as I just mentioned, which of course vary with a virtual treatment, but there are a lot of diagnostic assessments that we are able to do with virtual treatments. The questioning in itself is very powerful, and then observation of the complexion and the tongue we can do over video. And we can even teach patients how to do a somewhat simplistic checking of their own pulse qualities, which can be quite useful. And then once the diagnostic assessment is complete, if the treatment is in person, then a body treatment is usually given, which may include acupuncture, moxibustion, and or various types of body work. In my practice, what this commonly is cupping, Maya abdominal massage, tuina, and shiatsu. And then whether in person or virtual, there are usually recommendations for diet, lifestyle, perhaps supplements, often education on how recommendations and treatment relate to the patient's goals and condition, possibly instruction for Qigong exercise or other home therapies, and very often a Chinese herbal prescription. There's increasing scientific evidence that Chinese herbs and acupuncture have beneficial effects on the brain. Here is a list of biomedical parameters that have been shown to be impacted beneficially by Chinese medicine, including reducing inflammation, improving circulation, can cross the blood-brain barrier. Chinese medicine regulates sympathetic and parasympathetic nervous systems. It can balance hormones involved in mental and emotional processes. It can improve interconnections within the brain and modulates numerous regions of the brain. On a more clinical level, some of the ways we observe acupuncture and Chinese herbs affecting patients' brains include improved clarity, mental energy, motivation, relaxation, sense of well-being, and memory. In recent years, functional magnetic resonance imaging, also known as fMRI, has been widely used to show acupuncture's effects on the brain. This image is from a study that observed via fMRI patients' brains without stimulation compared to with various types of acupuncture. So this would be from the same individual. The 3 columns are of different areas of the brain, and the 4 different rows represent what input stimulation was occurring. So at the bottom, the control, there was no acupuncture happening there. The top row, MA, is manual acupuncture, which is basically normal acupuncture. And the middle two rows are two different frequencies of electrostimulation being applied to acupuncture needles, called electroacupuncture. And the different colors you can see as are different areas of the brain that are lighting up with increased blood flow. Well, either increased or decreased. So it's either a relaxing or a stimulating effect on the brain tissues. So anxiety, stress, and other mental emotional conditions such as frequent irritability, anger, or sadness, these are all treated quite effectively with Chinese medicine. They are conditions I work with all the time, and they are conditions that patients find great improvement in, even when their main goal with treatment is something else. So here I've listed a few of the most common patterns that underlie anxiety. For example, if someone has frequent bloating, issues with bleeding, craves sweet flavor a lot, has loose stools, then spleen chi deficiency would be likely. If they have a tendency to low iron, light menstrual periods, dry skin, and lightheadedness, blood deficiency would likely be at play. If their symptoms are worse with stress and better with exercise, worse before periods, they have lots of irritability and a wiry pulse, liver qi stagnation would be likely. Just to give some examples of some of the more common underlying patterns for anxiety. And then there's a phenomenon of qi ascending or going up excessively. So this is a concept that applies to most cases of anxiety. We can see it when, for example, the breath doesn't go down smoothly and there's shortness of breath, or when someone has palpitations or insomnia. These are all examples of energy going up too much and not going down enough. So treatments that incorporate descending energy are commonly beneficial for anxiety. In Chinese medicine, we often assess if the root of a disease is on a physical, energetic, or emotional level. And this answer to this question can impact what treatments look like. For example, any of these is possible, or for anxiety, any of these is possible, and therefore Chinese medicine can really address a wide variety of underlying causes of anxiety. The variety of treatment options common to Chinese medicine, including acupuncture, Chinese herbs, moxibustion, qigong, etc. Each of these independently can help greatly with anxiety, but combining them results in even better outcomes. So there are many ways to meet a patient where they are at and match their needs and preferences. So based on my personal clinical experience, what I have learned from ancient and modern texts, modern research, education, and conversations with teachers and colleagues, Chinese medicine is wonderful at helping folks to find peace, ease, joy, hope, and motivation. And I definitely recommend trying it out if this is something you would like some support with.